Next, absorption of fats. The uptake of lipids and the products of their breakdown in intestinal epithelial cells is by partial diffusion across plasma membrane. It is more rapid in duodenum and the initial part of jejunum, where the concentration of bile salt is very high. Two theories have been advanced to explain the mechanism of fat absorption. They are the lipolytic theory and the partition theory. According to the lipolytic theory, lipids are hydrolyzed to fatty acids and glycerol during intestinal digestion. These are soon absorbed to the intestinal mucosa and then resynthesized into fats. From the mucosa, nearly 70% of the fats enter the lymph and the remaining 30% enter the bloodstream. The fat containing lymph has a milky appearance and it is called chyle. According to the partition theory, lipids are not completely hydrolyzed during intestinal digestion but are partly broken down to mono and diglycerides and free fatty acids. These undergo emulsifications by complexing with bile salts. Emulsified glycerides are directly absorbed to lymph and emulsified fatty acids are absorbed to blood. The current concept of fat absorption is a compromise with the two theories and it can be summarized as follows. Fats are absorbed to the body fluid in three states, namely as triglycerides in the unhydrolyzed state, as diglycerides and monoglycerides in the partly hydrolyzed state, and as free fatty acids and glycerols in the fully hydrolyzed state. Glycerol is water soluble and hence its absorption does not encounter any problem. Low molecular weight fatty acids can also be absorbed without much difficulty. However, high molecular weight fatty acids could be absorbed only after bringing them to a soluble form. This soluble form is usually a fatty acid bile salt complex. The action of bile salt on fatty acid to form a water soluble complex is known as hydrotrophic action. Fatty acids can also be absorbed in combination with steroids, forming soluble esters. Soon after absorption, the fatty acid bile salt or fatty acid steroid complex breaks down, liberating the fatty acid. Three views are currently favored as the reasonable explanation of fat absorption. They are the following. Pinocytosis is the major mechanism for the absorption of neutral fats or triglycerides and phospholipids. Fats are first absorbed as fatty acids, glycerol and mono and diglycerides, and then neutral fats and phospholipids are synthesized from them in the villi before their transportation by the lymphatic system. The absorption of fatty acids, cholesterol, and other lipids by diffusion occurs after their solubilization. Fat absorption in human beings in particular and in higher mammals in general is completed in three successive phases, namely lumen phase, penetration phase, and intracellular phase. So, first phase, lumen phase. This is the phase of hydrolysis and micelle formation in the intestinal lumen. During this, fats or triglycerides in the lumen of small intestine is emulsified by bile salts and hydrolyzed by pancreatic and intestinal lipases and esterases. This results in the formation of a mixture of fatty acids, glycerol and mono and diglycerides, which forms aqueous suspension. Most of these fatty acids are long chain fatty acids, those with more than 12 carbon atoms. Glycerols are water soluble and they are directly absorbed by simple diffusion. Long chain fatty acids and mono and diglycerides are absorbed by a different mechanism with the help of bile salts. Bile salts form water soluble spherical aggregates called micelles. Fatty acids and glycerols dissolve in the center of the micelle, then micelles carry them to the epithelial cells of the villi. On coming in contact with the surface of epithelial cells, fatty cells and glycerides diffuse into the cells, leaving behind the micelles. The micelles return to the intestinal lumen and repeat this function. Occasionally, most of the bile salts may be absorbed from the intestinal lumen back to the bloodstream. Blood will return them to liver for resecretion. This cycle is called enterohepatic circulation. Within the epithelial cells, the mono and diglycerides undergo final hydrolysis, forming free fatty acids and glycerol. Short chain fatty acids may not be incorporated with micelles. They usually pass into the epithelial cells by simple diffusion and follow the same route as that of by monosaccharides and amino acids, but sometimes they may be transported into the epithelial cells by a sodium-dependent and carrier-mediated active mechanism. Within the epithelial cells, the glycerides are further hydrolyzed, forming free fatty acids and glycerol. Next, penetration phase. This is the phase of transport of micelles into intestinal mucosa from intestinal lumen. Bile salts and micelles together form micelle bile salt conjugates. These conjugates pass to the brush-bordered epithelium mostly by simple diffusion and occasionally by pinocytosis. In simple diffusion, bile salts simply act as a shuttle engine and push the micelles into the epithelial cells without themselves getting into the cells. Then intracellular phase. This is the phase of pre-esterification of fatty acids and glycerides and the formation of chylomicrons in the smooth endoplasmic reticulum of mucosal cells. During this, fatty acids, mono and diglycerides and glycerol enter the SER or smooth endoplasmic reticulum, undergo esterification and form triglycerides. This resynthesis of triglycerides is energy dependent and it requires ATP, Mg2+, and CoA. Soon the triglycerides in the SER aggregate into globules together with phospholipids and cholesterol. Then they get coated with proteins and form minute water-soluble particles called chylomicrons. The protein coat keeps the chylomicrons suspended and prevents them from sticking to each other. Chylomicrons leave the epithelial cells and enter the lacteals. The lymphatic system carries them to blood vascular system. Finally, they reach their liver through the lymphatic artery. Then absorption of cholesterol. Absorption of cholesterol takes place in small intestine with the help of bile salts. Its maximum absorption occurs when it gets mixed with fatty acids and bile salts. In the small intestine, the pancreatic enzyme cholesterol esterase hydrolyzes cholesterol esterase, releasing free cholesterol. It is readily absorbed to the epithelial cells by simple diffusion. In the mucosal cells, cholesterol gets re-esterified. These cholesterol esters get incorporated with chylomicrons and pass to the lacteals for transportation along the lymphatic channels. Then absorption of vitamins. Absorption of vitamins mostly occurs in the anterior part of the small intestine. Fat-soluble vitamins A, D, E, and K first dissolve in the micelles, then they are absorbed together with emulsified fat with the help of bile salts. Water-soluble vitamins are absorbed rapidly by simple or facilitated diffusion into the portal circulation across the brush border of the epithelial cells. The absorption of vitamin B12 is an exceptional case. A small portion of vitamin B12 is absorbed by pinocytosis. The remainder is absorbed by a special carrier-mediated mechanism. It involves the membrane carrier and a glycoprotein called Castle's intrinsic factor. This factor is secreted by the chief cells of the pyloric gland. In the stomach, vitamin B12 combines with the intrinsic factor or Castle's intrinsic factor and forms a complex. This vitamin B12 intrinsic factor complex passes to the small intestine. In the terminal part of the ileum, it attaches to a specific receptor site. This attachment requires ideal conditions of pH Ca2++ and Mg++. When the complex dissociates into vitamin B12 and intrinsic factor, vitamin B12 is soon absorbed into the cell. The fate of the intrinsic factor is not definitely known. Next topic, absorption of water. The epithelial lining of vertebrate digestive tract is highly permeable to water. So, absorption of water is possible throughout the length of the digestive tract. Still, colon is the major site of water absorption. Absorption of water is mainly a passive process and it takes place by osmosis. Some amount of water may be absorbed by pinocytosis also. In passive absorption, water can move across the intestinal mucosa in both directions, depending upon the osmotic gradient, which in turn is determined by the tonicity of the fluids in the two sides of the epithelium. Water always moves from hypotonic to hypertonic solution. Water absorption in the small intestine is always associated with the simultaneous absorption of electrolytes and digested food in order to maintain an osmotic balance with the blood. In the small intestine, there is continuous absorption of sodium and other electrolytes. As a result, the fluid in the intestinal lumen becomes hypertonic in relation to the blood plasma. So water passes from the luminal fluid to bloodstream across intestinal mucosa. At the same time, with the progress of digestion, large quantities of high molecular substance may be formed in the intestinal lumen. As a result, the luminal fluid becomes hypertonic or hyperosmolar in relation to the blood plasma. So water may be drawn from blood to the luminal fluid. This may reduce blood volume, produce peripheral circulatory failure and shock, and induces reflexes such as distension of intestine, nausea, vomiting, and other gastrointestinal and cardiovascular problems. Heavy intake of water can prevent this problem. Dumping syndrome is a similar problem commonly seen in patients with a large portion of stomach is surgically removed. In this case, food quickly passes to the duodenum without staying in the stomach. This rapidly increases the osmolarity of the duodenal content, leading to the osmotic flow of water from blood to duodenal content, distension of the duodenum, nausea, vomiting, fainting due to reduced blood volume. Then, absorption of electrolytes in detail. The electrolytes absorbed from the lumen of small intestine is mostly the constituents of gastrointestinal secretions. However, some are the components of intestinal solid and liquid foods. Electrolyte absorption involves both passive and active mechanisms. Sodium ions can freely diffuse across the intestinal epithelium in both the directions in a concentration gradient. Still, the greater part of this normal uptake from the lumen of small intestine is by active transport. Absorption of glucose and L-amino acid promote the simultaneous absorption of sodium, calcium, magnesium, iron, potassium, chloride, iron, phosphate, and nitrate ions as absorbed actively as well as passively. The passive absorption of Cl- is mostly by facilitated diffusion. Generally, the intestinal epithelium is slowly permeable to divalent and trivalent ions and freely permeable to monovalent ions. Since several divalent and trivalent ions are the common constituents of food, special transport mechanisms operate for their absorption from the intestinal lumen. In human beings, the active absorption of calcium depends much on vitamin D and parathyroid hormone. Next, we are going to learn about some topics related to nutrition like balanced diet, nutrition in pregnancy, dietary recommendations, nutrition in infancy, artificial feeding, breastfeeding, then some topics related to the importance of dietary fibers, some diseases related to this, and anorexia nervosa, bulimia nervosa, acidity, then peptic ulcers, obesity in detail, kinds, hypothalamic obesity, some other obesities like psychological obesity, regulatory obesity, metabolic obesity, hypertrophic obesity, clinical effects of obesity, starvation and fasting, then BMR in detail, role of minerals, then topics related to trace elements and principal minerals, trace minerals, I guess, then vitamin balance disorders, vitamin deficiency disorders in detail. So let's start learning about these topics with the help of this video or with the help of some other video sessions. So first, balanced diet. Balanced diet is the diet which contains all the bodybuilding and energy giving nutrients in the right amount and in the correct proportion needed by a person for optimum growth, health repair and reproduction. In other words, it is a diet which can provide all essential nutrients in sufficient amounts to meet the synthetic and energetic requirements of human body and to promote and preserve its normal growth and health. So it should essentially contain sufficient quantities of proteins, carbohydrates, lipids, vitamins, minerals and water for promoting and regulating metabolic processes. Cow's milk is generally regarded as a natural balanced diet because it contains enough quantities of all essential nutrients. The balanced diet recommended for children, adolescents, and adults are given in the following table, not shown in this picture. I will be explaining that later. A balanced diet must provide enough food to the body for meeting energy needs. At the same time, energy from cereals should not exceed more than 75% of total requirement. Energy from fat or oil should not exceed 15% of the total calories. The energy from refined carbohydrates like sugar, jaggery, etc. has been recommended around 5% of the total calories. A balanced diet must provide enough proteins for building up and repair of tissues, secretion of digestive juices, synthesis of body proteins, enzymes and hormones. Fats, oils and minerals must also be available in sufficient quantities from balanced diet. For planning a balanced diet for low income people, Low-cost nutrient food items have to be selected. Ragi, sweet potato, tapioca, cluster beans, soybean, bitter gourd, drumstick, leafy vegetables, sprouted pulses, grams, groundnuts, gooseberry, guava, papaya, mango, and other seasonal fruits are ideal for a low-cost balanced diet. Next major topic include nutrition in pregnancy. Pregnancy is just a physiological phase characterized by the rapid growth of both mother and fetus. So during pregnancy, mother and fetus require rich and regular supply of nutrients. Poor maternal nutrition during pregnancy may cause the depletion of mother's food reserves and the low birth weight of the baby. Sometimes it may also cause the low vitality and premature death of the baby. Before and during pregnancy, a woman needs sufficient nutrients for maintenance, for the development of breasts, uterus, and placenta, and also for the formation of amniotic fluid. Also, she has to supply enough nutrients for the intrauterine growth and development of the fetus. A full-term pregnant woman must gain 10 to 12 kg weight, and for this, she must get adequate food and sufficient nutrients. Underweight of a pregnant woman may contribute to the small size and low birth weight of the child. Such infants are highly prone to infectious diseases and high mortality. Overweight of the mother during pregnancy is also harmful. Overweight at the beginning or during the second or third trimesters of pregnancy may result in convulsion or coma during pregnancy. Eclampsia, especially during the last months of pregnancy. The recommended weight gain of women in pregnancy is 1.5 kg during the first 3 months, 1.5 kg or a little more during the last 2 trimesters. Sudden gain or loss of weight during pregnancy is harmful to both the mother and the fetus. Then, marked nutritional deficiency in the diet of a pregnant woman is severely harmful to both the mother and the child. Deficiencies commonly occur with respect to calcium, iron, phosphates, and vitamins. Deficiency of calcium, phosphate, and vitamin D hampers the normal development of bones and teeth in the fetus. Iron deficiency leads to low RBC count, low hemoglobin content, and subsequent anemia in mother and child. Deficiency of vitamin K plus very seriously affects blood clotting. So, some dietary recommendations. A pregnant woman needs increased energy allowance to raise the basal metabolic rate or BMR and to support the growth of the infant, fetus, placenta, and maternal tissues. For an average Indian woman with less than 50 kg weight, the total energy cost for pregnancy is nearly 62,500 kilocalorie. Apart from this, some energy is stored in the fat deposits during pregnancy as a reserve for lactation. An extra intake of 300 kilocalorie per day is necessary during the second and third trimester of pregnancy. This could be satisfied by the addition of 35 grams of cereals and 10 grams of sugar or jaggery to the normal balanced diet. 35 grams of cereals and 10 grams of sugar or jaggery to the normal balanced diet. During pregnancy, an increased intake of proteins is essential for the development of placenta and fetus and also for the growth of maternal tissues. An additional intake of 14 grams of proteins is sufficient. This extra protein demand can be satisfied by the addition of 100 ml of milk and 15 grams of pulses to the normal diet. A normal balanced diet can satisfy the fat requirement for a developing fetus. The liver and brain of the fetus contain phospholipids, which are rich in essential fatty acids, so additional supply of dietary fat is not normally required. A pregnant woman requires sufficient supply of calcium, phosphorus, iron, and iodine. Calcium and phosphorus are essential for the strengthening the bones and teeth of the developing fetus. Iron is essential for the formation of hemoglobin. During pregnancy, a woman needs nearly 400 mg of iron for the formation of hemoglobin and 250 mg for storage in the fetus. For this, an additional supply of 8 mg of iron per day is recommended. Sufficient quantities of iodine may be supplied for the synthesis of thyroxine and also for the prevention of goiter in both the mother and the child. All vitamins are required in sufficient quantities during pregnancy for normal growth and metabolism in mother and fetus. However, the exact quantity of most of them needed during pregnancy is not definitely understood. Vitamin K is especially important for the formation of prothrombin in the baby to prevent hemorrhage caused by the birth process. Vitamin D is essential for the proper absorption of calcium by the fetus from the mother. In pregnant women, 5 or 6 small feeds with regular intervals are more desirable than 3 or 4 heavy meals. This is to avoid fullness of the stomach. Leafy vegetables, fruits, and fluids are better for normal bowel evacuation. Rich, highly spaced and fried food, rich caviars, heavy desserts, and excessive salts and condiments must be avoided to reduce weight gain. Sugar must be substituted by jaggery since the latter contains more iron. The composition of the balanced diet recommended by the Indian Council of Medical Research for pregnant women is as follows. Cereals 475 gram, pulses 55 gram, leafy vegetables 100 gram, other vegetables 40 gram, roots and tubers 50 gram, milk and milk products 250 ml, oils and fats 40 gram, fruits 60 gram, sugar and jaggery 40 gram. Next, nutrition in infancy. Infancy is a physiologically important state in the life of human beings. It is characterized by rapid growth, profound changes in body composition, biochemical and physiological maturation of the body, accelerated internal activities, and high BMR, and so on. For this, an infant needs all nutrients in sufficient quantities. This nutrition during infancy appears to be very vital as the foundation of future growth and health. During early infancy, the secretion of pancreatic amylase is very low. The intestinal absorption of fats occurs at a low rate, and synthesis of proteins from amino acids is most efficient. So, the consumption of starch-rich food must be reduced. The consumption of fat-rich items such as animal milk should be minimized, and the consumption of protein-rich food must be maximized. Why? Because secretion of pancreatic amylase is very low. The intestinal absorption of fats occur at a very low rate. So, when we provide, fat-rich items, there won't be any sufficient growth in the child. So the synthesis of protein from amino acids is most efficient. So we will be providing protein-rich food. An infant has high needs for calcium, vitamin D, and iron. Calcium is for the ossification and strengthening of bones and teeth. Vitamin D promotes the intestinal absorption of calcium, and its deficiency may cause rickets. Iron is essential for the formation of blood cells and the synthesis of hemoglobin. The birth weight of a normal newborn baby gets doubled by the 5th month and tripled by the 12th month, provided all nutrients are available in sufficient amounts. A lactating mother can successfully breastfeed her baby during the first 3 or 4 months. Beyond that period, breast milk alone will not be sufficient, and so the baby needs supplementary food supply. Malnutrition impairs the physical growth and health and the mental and intellectual development of the baby and adversely affects its immune powers. Infants in the age group of 0 to 3 months require 120 kilocalories of energy and 2 gram of protein every day per 1 kilogram of body weight. An average mother can secrete as much as 600 ml of breast milk per year and per day and can provide 420 calories and 7.2 gram of protein. Vitamins are essential for the normal growth and development of the infant. At the same time, breast milk may not supplement all vitamins in required quantity. So, supplementary feeding is recommended for children to avoid vitamin deficiency. The recommended daily dietary requirement for some nutrients of infants are given below, like 0 to 6 months, calories 118 kilocalories, protein is about 2 gram, calcium 0.5 to 0.6 mg, iron 1 mg, then vitamin A 4000 mg, like that. Then artificial feeding. Fast social life, urbanization, employment status, and the modern lifestyle Fast social life, urbanization, employment status, and modern lifestyle have all contributed much to the disinclination of the present day mothers to breastfeed their babies. Coupled with this, the commercial pressure from the advertisement of baby foods, ignorance about the advantage of breastfeeding, and the misleading belief of mothers that breastfeeding would adversely affect their health and physical charm have encouraged the artificial feeding of the babies. The common artificial feeds include animal milk, the milk of cows, buffaloes, goats, sheep, camel, etc., goat milk, soybean milk, banana powder, juice of fresh fruits, boiled leaf vegetables, mashed banana, pumpkin and egg yolk, powdered or double cooked cereals and pulses, meat soup, various commercial products, etc. Studies have revealed that morbidity and mortality rates are higher among artificially fed children than among breastfed children. Animal milk can be given to the baby after the first 1 or 2 months. In this case, the milk has to be sterilized, diluted, and sugared, and its fat content has to be properly regulated. Equal amount of boiled milk and boiled water are enough during the first 3 months. Equal amount of boiled milk and boiled water. Then the quantity of boiled water can be reduced as the child grows. The number of feeds varies with the age of the child. 7 feeds per day are recommended during the first month, 6 feeds during the second to the 7th month, and 5 feeds during the 8th month to 1 year. Fruit juices and cooked cereals can be introduced from the 3rd month onwards, and egg yolk, mashed vegetables, vegetable soups, and other supplementary items from the 6th month onwards. The formula of animal milk feed recommended for infants is like 0.1 first 0 to first month, turned milk 400 ml, water 400 ml, sugar 20 gram, feeds per day 7. After that, until 11th 12th month, feeding just reduces to 6, and then 8 to 12 month, 11th month, 5 time feeding. Breastfeeding. Breastfeeding is a complete and balanced food for a baby during the first few months of its life. So a newborn baby depends heavily on breastfeeding for some time for its sustenance and growth. Breastfeeding is significant in 2 ways. On one hand, it supplies the baby almost all nutrients in sufficient quantities and transfers it to maternal antibodies to provide immunity against infections. On the other hand, it reduces the chances for mastitis and malignancies in the mother. Studies have revealed that mothers who neither breastfeed their children nor empty their breasts will have higher chances of mastitis and breast cancer. Human milk is more watery than the milk of cow, buffalo, goat, and sheep. At the same time, its nutritive value is higher than that of cow's or buffalo's milk. The major contents include water, lactose, casein, lactalbumin, and other proteins. Calcium and other constituents include fats, vitamin A, B1, B2, and C, calcium ion, etc. During the first 2 days after birth, the mother secretes an yellowish fluid known as colostrum. During the first 2 days after birth, the mother secretes an yellowish fluid known as colostrum. It is highly nutritious and it's rich source of vitamin A and antibodies for the baby. Even then, the common belief is that colostrum is not good for babies. That's misconception. Okay, so breastfeeding in human beings is significant in many respects. Some of its advantages are given below. For example, advantages for the baby. Breast milk is complete and balanced food and it contains all the essential nutrients in the correct proportion required by the body. So, for no suitable substitute has been formulated to replace it. Human milk is dilute and easily digestible and it forms the most ideal food for the baby during the initial days. Breast milk supplies the baby not only the essential nutrients but also the maternal antibodies. This provides it protection from infectious diseases. It has been shown that artificially fed children are more prone to poliomyelitis, influenza, mumps, and several other infectious diseases. So, milk allergy, constipation, gas formation, and gastrointestinal discomfort are less common among breastfed babies. Breastfeeding provides the baby emotional security and a feeling of comfort and well being. Then advantage for mother, breastfeeding and emptying of breasts reduce the risk of mastitis, breast cancer and ovarian cancer in lactating mothers. Breastfeeding helps uterus to gradually return to its normal form and size after delivery. Breastfeeding delays the resumption of sexual cycle and ovulation. Breastfeeding helps to establish a strong bond of love and affection between the mother and the child. Breastfeeding provides the mother some relaxed time, free from tensions and worries. Then advantages for society. Breastfeeding cuts down the cost of infant health care since breastfed infants require relatively fewer healthcare visits, less medication and less hospitalization. So the expenditure on medical care will lower for fully breastfed infants than for non breastfed infants. Breastfeeding avoids the environmental problems that are caused by trash and plastics. Breastfeeding is not desirable if the lactating mother is suffering from tuberculosis, typhoid, neurosis, psychosis, septicemia, calcibia, etc. Then let's learn about some risks of insufficient breastfeeding or lack of breastfeeding. High susceptibility to infectious diseases. Breast milk transfers enough antibodies to babies to provide them immunity against infectious diseases. So, lack of breastfeeding makes them more susceptible to a wide variety of diseases and thereby contribute to high infant mortality. Higher chances of sudden infant death syndrome or SIDS. Total lack of breastfeeding causes a high rate of SIDS in early infancy due to high risk of juvenile diabetes, leukemia or blood cancer, lymphoma, lymph cancer, then lymphodenoma, Hodgkin's disease, progressive enlargement of lymph glands all over the body, asthma, cholesterolemia, obesity, etc. Then growth impairment. Breast milk is a complete balanced food which has no substitute. So absence of breastfeeding in all probability may impair normal growth and development. Next topic, importance of dietary fibers. Dietary fibers, commonly called the brughi or bulk, are the polysaccharides and lignin of plant cell walls which cannot be hydrolyzed by the digestive enzymes of animals. Their normal components include cellulose, hemicellulose like xylins, mannans, arabinins, galactans, hexosins, fructosins, and galactans, lignin, pectic compounds, gums, and mucilages. Cereals, pulses, tubers, green vegetables, nuts, fruits, etc. are rich sources of dietary fibers. In mammals, fibers are believed to be digested by the enzymes secreted by some symbiotic bacteria inhabiting the large intestine. The dietary sources rich in fibers include legumes, fruits, bran of cereals, green leafy vegetables, tubers, etc. Then significance of dietary fibers. Dietary fibers are significant in several respects. Some of them are water soluble and they form a gelatinous bulk in water that can lower cholesterol. Others are water insoluble and they add to the bulk of the stool. The major roles of dietary fibers in man are following. Some dietary fibers undergo fermentation in the colon, producing flatus and organic acids. The organic acids include volatile fatty acids such as acetic acid, propionic acid, butyric acid, and small amount of lactic acid. These acids are absorbed and utilized as a source of energy. Then dietary fibers absorb water and soften feces, promote intestinal peristalsis and bowel movement, bringing about comfortable defecation and prevent constipation. Fibers influence the functioning of colon by affecting the bulk, weight composition, and the transit time of feces. Fibers bring down blood glucose level and thereby reduce the chances for diabetes mellitus. This is due to their negative influence on the intestinal digestion and absorption of carbohydrates. Then, pectin fibers can lower the level of serum cholesterol and thereby prevent cholesterolemia, atherosclerosis, and other cardiovascular diseases. Fibers accelerate digestion and ejection and thereby help to sweep out harmful wastes even before they cause problems in the body. High fiber content expand the colon and render defecation easier. Fibers increase the excretion of bile acids in the stool. Fibers help to prevent colon cancer by the rapid elimination of feces and also by binding and inactivation of carcinogenic animals. Stagnation of feces in the colon may cause the production of carcinogenic chemicals by the action of intestinal bacteria in the steroids of stools. The presence of fibers causes their rapid elimination or inactivation. Thus, it becomes very clear that fiber-rich food reduces chances for constipation, diabetes mellitus, colon cancer, cholesterolemia, atherosclerosis, and other cardiovascular diseases. Dietary fibers have some harmful effects also. They adversely affect the intestinal absorption of minerals, vitamins, sugars, amino acids, fatty acids, and glycerol. This in turn may lead to several nutritional deficiency disorders. Deficiency of dietary fibers. Prolonged and extreme deficiency of dietary fibers may lead to several diseases. Some of the major diseases are the following: colonic diseases, colon related, constipation, appendicitis, appendicitis, piles or hemorrhoids, irritable colon, ulcerative colitis, colon cancer. Then metabolic diseases, obesity, diabetes mellitus, ischemic heart disease, varicose vein, pulmonary embolism, gallstones, kidney stones, rheumatoid arthritis, multiple sclerosis, senile osteoporosis, pernicious anemia, then endocrine diseases, thyrotoxicosis, exophthalmic goiter or Graves' disease, myxoedema, Hashimoto's disease like autoimmune thyroiditis, firm and enlarged thyroid, Addison's disease, other diseases like dental caries, like tooth decay, hiatus hernia, displacement of a portion of the stomach through an opening in the diaphragm. Then Crohn's disease or ileitis or inflammation of ileum. Next, we are going to learn about a disease called anorexia nervosa. Anorexia nervosa is a disorder characterized by the loss of appetite and bizarre patterns of eating. Appetite is the craving for food. Unlike hunger, it is probably an acquired sensation rather than an inborn trait. Thus, a newborn baby experiences hunger, but probably not appetite. This is something which happened in my case also when I was a child. When I need food, I just end up being angry or I might end up crying. Later, I just realized when my mom just initially realized this is because of she's hungry, but at the same time, I was not able to recognize this. This condition was, constantly happened when I was in a fifth standard, but still my mom used to understand this, but I was not able to understand that I'm hungry. I thought this is because the situation is, kind of stressful, so I'm reacting to that stress. But later, I just acquired this craving for food or appetite. After that, the process was very easy. When I get hungry, I just develop appetite, so I just eat, and then that process is more comfortable. So, thus, a newborn baby experiences hunger but probably not appetite. Diminished appetite is common to almost all diseases which cause general weakness. This is because the activity of the stomach and the secretion of gastric juice fall very low when the vital processes are slow. Diminished appetite is a commonest symptom of dyspepsia or indigestion and stomach cancer. In some cases, it is a manifestation of stress or strain. Diminished appetite is usually associated with feverish states. The reason is that in such conditions, digestive functions become weak and slow, and people must restrict themselves to light diet. Anorexia nervosa, or the loss of appetite, is found predominantly in unmarried girls in their teens following the onset of puberty. It may occur in older girls and women also, but it's very rare in males. The precise cause of anorexia is obscure, and used that it represents a psychological repression in females who are ill prepared to meet the responsibility for adulthood, especially of adult sexuality. So the sufferers physically revert to a non menstruating, childlike state, and physiologically, many of their feelings, including the sexual urge, get suppressed. So, anorexia patients have a high fear of becoming fatty. From this fear, they develop curious eating habits such as disinclination to eat in the presence of others, refusal for regular eating, etc. Anorexia is a serious condition with nearly 5% mortality. Suicide is the commonest cause of death. Severe and progressive starvation is the physical consequence of anorexia. The depressant effects of starvation include amenorrhea, absence of menstruation, and low BMR. Individuals may become emaciated and may ultimately die of starvation or its complications. Often, brain abnormalities and impaired mental efficiency may also be seen associated with the disorder. The common health risks or medical consequences of anorexia include severe impairment of normal growth, extreme high weight loss, low and irregular heartbeat, irregular menstrual cycle or amenorrhea, low body temperature, weak bones due to lack and loss of minerals, osteoporosis, then bulimia nervosa, which we will be learning after this. In women, anorexia very seriously affects pregnancy with high rates of premature delivery, abortion, or miscarriage. Recovery from anorexia is very slow and tedious, and it is possible in about 40% of cases. Treatment involves dietary regulation and psychotherapy, including family therapy. The response to medical treatment need not to be hopeful or promising. There must be some therapies, so that psychotherapy in particular, and along with the family therapy, so that this is a psychological disorder to a greater extent. That's why therapy is needed. Then next disease, bulimia nervosa. Bulimia, I'm not sure about the pronunciation. Bulimia nervosa. This is a variant of anorexia nervosa. It is an eating disorder characterized by uncontrollable urge to eat large amounts of food, followed by induced vomiting and constant abuse of laxative to expel the ingested food and to avoid any gain weight. Continued abuse of laxatives may damage the bowel muscles and impair their function. Bulimia nervosa is most common among women in their 20s. The condition is often accompanied by irregular menstruation, often leading to amenorrhea, absence of menstruation. The response to treatment, as in anorexia nervosa, is far from satisfactory. Then next, acidity or acid peptic disease or APD is a condition in which the contents of the digestive tract become acidic due to an excessive production of HCl by gastric glands. Emotional upsets, alcoholism, smoking, consumption of highly spicy food, non-vegetarian diet, chronic use of non-steroidal anti-inflammatory drugs or NSAID, some of contributing factors to gastric acidity. Also, excessive secretion of acid occurs in certain situations, such as Zollinger-Ellison syndrome, in which acid secretion is stimulated by tumors in pancreas and duodenum. The major symptoms of peptic acidity are dyspepsia or injection, frequent regurgitation of gastric contents, chest burn, peptic ulcers, etc. Chest burn is the burning pain behind the sternum, most usually after meals during strenuous work, etc. The gastrointestinal wall can protect itself from the destructive actions of acids and histolytic enzymes. Its mucous lining forms the first line defense against acidity. The mucus discharged from this lining can dilate and neutralize acids and thereby protect the gut wall. The bicarbonates brought to the mucosa from the other parts of the body can also neutralize the acidity. Prostaglandins, lipid soluble, long chain organic carboxylic acids, probably promote bicarbonate production and mucus secretion and thereby indirectly protect the gut wall from acidity. Acidity becomes harmful when one or more of these defense mechanisms become inadequate or less effective. Identifying and avoiding the causative factors are essential for the treatment of acidity. Option of a suitable diet, excluding spicy, pungent, acidic foods, is very important. Smoking and consumption of alcoholic beverages must be stopped. The use of drugs like steroids and NSAIDs must be avoided as far as possible. Those who are emotionally sensitive and those who are engaged in stressful jobs must try to modify their lifestyles to reduce this mental tension. Antacids provide immediate and temporary relief in the discomfort by neutralizing the excess acid. Drugs called H2 receptor blockers block histamine receptors and thereby reduce the gastric secretion of HCl. H2 receptor blockers. Another group of drugs called proton pump inhibitors selectively inhibit specific acid making mechanisms within cells. Surgical methods such as vagotomy are sometimes adopted to reduce acid production. Then flatulence. Flatulence is the collection of gas in the stomach or bowels. In the former case, the gas will be frequently expelled in noisy eructations by the mouth. In the later case, it may produce unpleasant rumblings in the bowels or may be expelled from the anus. The presence of gas in the stomach, gastric flatulence, may be due to habitual gulping down of air when digestion is uncomfortable. This is common among those who suffer from acid dyspepsia. The presence of gas in the bowels, intestinal flatulence, is usually due to bacterial fermentation. Some of the carbohydrates which cannot be digested by intestinal and pancreatic enzymes are metabolized by the symbiotic bacteria in the colon and lower ileum. The products of this bacterial metabolism include gases such as H2, CH4, and CO2, and some intestinal irritants such as some short chain fatty acids. Apart from this, hydrogen sulfide and carbon disulfide are formed from eggs, peas, and other sulfur containing food items. The consequences of this include increased fluid secretion and intestinal motility, diarrhea, cramps or gas pain, bloating, and flatulence. Gastric flatulence can be controlled by controlling dyspepsia by the administration of carminatives and also by avoiding the habit of gulping in of air. Intestinal flatulence may be controlled by avoiding green vegetables, starchy food, and which tend to decompose. Then peptic ulcers. Ulcer is a cancer-like lesion in a membrane. Peptic ulcers are open lesions or ulcers in the mucous membrane of some areas of alimentary canal that are exposed to the action of the acidic gastric juice. Peptic ulcers in the stomach are called gastric ulcers, and those in the duodenum are called duodenal ulcers. When the acidic gastric juice comes in contact with the mucous membrane, disintegration and necrosis of tissue occur, leading to ulceration. Discomfort and burning sensation in the stomach are the initial signs of peptic ulcer. The prevalence of peptic ulcers varies with sex and age. They are more common among men than among women, and they become more common as age increases. In India, peptic ulcers are more prevalent in South India. Low protein diet with plenty of spices may be the major reason for this. There is no general consensus as to what exactly is the precise cause of peptic ulcers. Injury to the epithelial lining and inadequacy of the mucous defense are the immediate causes of peptic ulcers. This in turn results from the hypersecretion of HCl and pepsin and the hyposecretion of mucin. What probably happens is that there appear some abrasions or breaks in the mucosa which get gradually eroded and deepened by the action of gastric juice. The major proactive factors which stimulate the hypersecretion of acidic gastric juice include excessive emotions, mental stress and strain, protein-rich foods, overstimulation of vagus nerve, 10th cranial nerve, etc., smoking, alcoholism, irritating foods, condiments such as chili, pepper, and ginger, strong coffee and tea, irregular dietary habits, and ulcerogenic drugs, aspirin, respirin, salicylate, phenylbutazone, corticosteroids, etc., probably attenuate or aggravate peptic ulcers. Normally, mucous membranes can resist its own degradation by gastric juice. However, in some cases, this resistance is lost with the result that some portions of the mucosa gets dissolved and ulcers develop there. Often climatic conditions exert some influence on the occurrence of peptic ulcers. In our country, monsoon season records the highest incidence of peptic ulcers. The major causes and contribution factors responsible for the hypersecretion of gastric juice and the formation of the aggravations of peptic ulcers are following: genetic predisposition and familial tendency, emotional turbulence and mental stress, overexcitation of vagus nerve, smoking, alcoholism, irregular food habits, then skipping of timely meals, excessive consumption of irritating foods, condiments, strong coffee and tea, etc. Regular use of anti-inflammatory and ulcerogenic drugs, chronic disorders and diseases such as liver compliance, emphysema, rheumatoid arthritis, etc. This probably contribute to the vulnerability to peptic ulcers. The bacterium Helicobacter pylori is believed to play an active role in causing and aggravating peptic ulcers. Its transmission occurs through contaminated food and water. Peptic ulcer may develop in the lower part of the esophagus, lesser curvature of the stomach, and the initial part of the duodenum. Thus, there are three kinds of peptic ulcers: esophageal ulcers, gastric ulcers, and duodenal ulcers. Esophageal ulcer is very rare, where the others are common. Gastric ulcer and duodenal ulcers are common. 1 in every 20% is believed to suffer from gastric ulcer. Duodenal ulcer is 10 to 15 times more common than gastric ulcer. May develop at any age from the 20th year onwards. Gastric ulcer, on the other hand, usually develops after the age of 40 years. Gastric ulcer is rare among women until after menopause. In general, duodenal ulcer is more common among the upper social classes, and gastric ulcer is more common among the lower social classes. There is also higher incidence of duodenal ulcer among individuals having O group blood. Gastric ulcers may sometimes become malignant, but duodenal ulcers are commonly almost always benign. Persons engaged in busy occupations, businessmen, executives, professionals, are more prone to peptic ulcers because of their emotional turbulence. The danger inherent in peptic ulcer is the erosion of the muscular layer of gastric and duodenal walls by the action of gastric juice. The deepening of this erosion may damage blood vessels and cause fatal bleeding called hematemesis. This condition in which a peptic ulcer erodes all the way through the gastric or duodenal wall is called perforation. Perforation, a kind of hole. Perforated ulcer allows the escape of bacteria and partially digested food into the peritoneal cavity, causing peritonitis. Perforation of this major cause of death from ulcer. High discomfort and burning and severely painful sensation in the abdomen are the preliminary symptoms of peptic ulcer. The symptoms usually come on 2 to 3 hours after a meal and also during night. If not timely treated, the pain persists for an hour or more. Abdominal pain is often accompanied by vomiting, especially in advanced cases where the ulcer blocks the passage of food from stomach to duodenum. Peptic ulcer can be acute or chronic, as the case may be. Acute peptic ulcer is short-living and it progresses rapidly to a favorable or unfavorable termination. On the other hand, chronic peptic ulcer is long-lasting and it persists for months or even years. In some chronic cases, the ulcers are large-sized or multiple with diagnostic symptoms. In some others, marked symptoms are altogether absent. Severe kinds of peptic ulcer have possibility for 3 complications, namely fatal hemorrhage, perforation, and obstruction of pylorus due to contraction of stomach wall with response to ulceration. Next topics related to this, like fasting and obesity, starvation, which will be dealt with the help of next video. Thank you for listening.